All right. First technology hurdle over. Okay. So back to the welcome. As I just mentioned earlier, this is a webinar for people who are familiar with PHE. There's some great resources from our partners in the chat if you want to check out those. And certainly you can reach out to any of the speakers for any additional information. For those of you who are not familiar with ABCG, I'm going to share my screen. Here's the PowerPoint. Hopefully you guys can see it. Can anyone just give me a yes that they can see it, just to make sure verbally?
Yes.
Yes.
Excellent. Thank you. Go team. Okay, so if you don't know about Africa Biodiversity Collaborative Group, which I hope you do, we are a collaboration of 7 environmental conservation organizations with many headquarters in the US, but also based in Africa. We do work together, obviously part of our collaboration, to increase collective conservation impact. And I think one of the best things about ABCG is that this is one of the few places where these organizations all work together for common goal, and there's not so much that competition, you know, we're really in this all together. So we're a partnership, we convene, we collaborate, we co-create, and we work very closely with our colleagues in Africa to make sure that biodiversity solutions that we're proposing and innovating really make sense in the field context there. And we have had a really great multi-sectoral aspect over the past couple of years. So we're really fostering collaboration on learning. We're really looking at getting our knowledge out, and then really hoping to scale up some of the innovative solutions that have really been based in the field. And then this particular task that we're working on, there are several other groups that work on land use and climate change and other, you know, pressing threats to biodiversity in Africa. But this particular group that we're talking about now is working on population health and environment, and really trying to meet human health needs, especially for family planning and reproductive health, and how they relate to restoring ecosystem services. So it's a big concept. There's a lot in there, and we'll dig into that a little bit deeper right now. So, but before we go any further, I want to just do a Mentimeter exercise just to get you guys kind of in the headspace. So if you can go to menti.com on your phone and type in this code, it's 38435102, and I have to leave the presentation to be able to go over to the Menti. So here's the question. What is the population of Africa today, approximately? And you got 3 choices. One is almost 1 billion, 1.3 billion, or 2.2 billion. So put in your best guess and let's see what people say. Okay, we got some answers coming in. Perfect. Give everyone just a couple minutes. Okay. Excellent. So the answer is, for those of you who haven't participated yet, 1.3 billion. And this is according to the UN figures. So the world is at 7.8 billion right now. And Africa does have one of the fastest growing populations, with about 4.5 children being born per woman a year. Okay, so what's the next question? What's the projected population of Africa in 2050? So 30 years from now, what's the population going to be? 2.5, 3.2, or 5.4? What do you think? Okay. Great. All right. So maybe some kind of good news is that it's only going to be 2.5 billion So those of you who thought it was going to be 3.2, that's a little bit high. But recognizing in 2050, the population will have doubled from what it is right now in Africa. So just to show that there is this growing population. And then, you know, on the flip side, I did try to look for a figure on unmet need for family planning, you know, when married women want to delay or postpone having a child, and you know, do they have access to family planning? And the number I came up with was 1 in 4 women. So obviously there is very much a need for people to do more birth spacing and family planning. So there is that need there. And then connecting that to our issues today. So the term population health environment means many things to many people. So in 1 or 2 words, kind of put in there, what does it mean to you? Like, what do you think of when you think of population health environment, and how these family planning, reproductive health, maternal health, conservation, nature, how is that all connected? So maybe just put in a couple words and let's see what pops. Great. Thanks very much for everybody's inputs. And the bigger words are the ones that we're seeing more often, right? So the question of choice, you know, voluntary family planning is obviously an underpinning tenet of all of our work in family planning, reproductive health.
Janet, just a couple of notes in the comments is that we can't actually see what you're seeing in terms of the Menti results. So you may just need to stop sharing and reshare your screen.
What? Oh, I'm so sorry. Stop sharing and resharing. I'm sorry about that. Thank you for letting me know. Okay. Apologies for my technology issues. Okay, how about now? Can you see that?
It's coming. Yeah, we've got it now.
Okay, thank you for letting me know. Sorry about that, guys. So it probably also is a little bit small, but I think you guys are getting the sense that we are talking about choice, rights, access, definitely equity, and healthy families. The whole idea of healthy families, healthy communities, healthy ecosystems, and really being able to combine these things together into a comprehensive, holistic package, definitely. Okay, great. Thank you guys so much, and apologies about the technology snafu there. Great, so great to see we have a lot more people joining us. Thanks very much. Okay, so I did the interview to ABCG, we did the warm up, and now I am going to hand it over to David Johnson from the Margaret Pike Trust, and he is going to, sorry, I have to find my presentation. He's going to share with us information on what's going on with, there we go. So can you guys see the screen now?
Yes, we can.
Okay, so David, over to you to tell us about IUCN and the task force on reducing barriers to family planning.
Thank you. I really appreciate the opportunity of us being included in this. And so before I start properly, a quick shout out to my co-chair of the task force, which is my new colleague, Rumbi Gumbi, who only started with us a couple of weeks ago. And therefore we decided not to force her to do this in her first couple of weeks. But yeah, I'm really pleased that she's joined us because we now have a new population health environment manager. So next slide, please. So the reason I put this slide here is because it's actually the landing page of the Margaret Pike Trust's website, because we're very grateful to be on this talk with such large conservation organisations, but we're quite different. So as you can see from our landing page, on the left-hand side, we do a lot of very traditional reproductive health work. We train about 1,000 doctors and nurses a year in the UK on very traditional kind of update conferences for doctors and nurses. So on the one hand, we do that type of work, but then on the other hand, on the other side of the website, you'll see we're talking about family planning and the environment. And that's because we took the decision 5 years ago to join IUCN and become the first IUCN member with 50 years reproductive health expertise, because we wanted to be on the inside of conservation and climate bodies to try and change policy from actually being within the group rather than talking from the outside. So we're observers of UNFCCC and of UNEP. And then on the other hand, we also develop PHE projects, including with the International Crane Foundation and the Endangered Wildlife Trust that are on this call. So our whole purpose was to be the reproductive health organization working on the inside. So could I please have the next slide? Sorry, Janet, can I have the next slide?
Yeah, when I move the bar, it won't let me advance. So.
It's not a staggering slide, so I wouldn't worry too much. On the next slide, which you can just imagine, is just the title of the motion. And that's really critical, actually, because the title of our IUCN motion is the importance for the conservation of nature of removing barriers to rights-based and voluntary family planning. So I wanted to share with you why it has this title, because PHE is not in the title and neither is population. So the framing for us was really critical. We did some research and found out that there wasn't or hasn't been a motion voted on by IUCN for 30 years that references population. So we knew that we wanted to do something different. So then, of course, all of our work relates to barriers to family planning, whether we're training doctors and nurses in Uganda or in the UK or on the policy perspective. So the framing was different, and we think that's why it's been really successful. So there's 4 key calls from the motion. Firstly, we wanted to set up a task force that was cross commissions to, and I'll read this bit, to develop guidance on how and why removing barriers to rights-based voluntary family planning can strengthen conservation outcomes, in addition to promoting the health, well-being and empowerment of women and girls. The second call from the motion is to IUCN member states, and that was actually a very specific one. We want to try and get member states to include the importance of removing barriers to family planning in their national plans under the Convention on Biological Diversity. And then the third and fourth calls, sort of grouped together, are effectively urging members of IUCN and others to undertake internal training on what PHE is and what barriers to family planning are, and to consider a pilot PHE project or finding a partner to do that with. And we had a range of co-sponsors, including CI, EWT and ICF that were on this call. But what was really important to us was that we had a range of global and national NGOs and NGOs represented from all regions. But please have the next slide, Janet. So our plan was to be really big at World Conservation Congress in Marseille. So we wanted to have use our very positive framing, focusing on barriers to family planning and not population. And we were, I think, the third organization to purchase a pavilion at Congress, which is called Family Planning and Biodiversity Pavilion. And the point was, in all of our work, we're just trying to normalize barriers to family planning being seen as a conservation issue. So I think the first organizations to get their pavilion were France and UNDP. But the point was that if you're a delegate walking around in Marseille, you would have seen family planning. We had, as the pavilion, we'd organized 40 events with about 50 or 60 organizations that were going to speak. And we wanted to really drive home that there was so much focus on this as a growing topic, and it was normal. Now, of course, the plan didn't quite come off because we all know that Marseille has been postponed. But if we move on to the next slide, I'll talk about the vote, because all of our work behind the scenes with such a broad range of co-sponsors, we had 2 commissions on board that are named in the motion. We did stuff with the Secretariat and various other groups. And presenting this as a really positive topic meant that we were fortunate that we were one of the 109 motions selected from the 128 total that was deemed to be non-controversial. So it went into the electronic vote, so members didn't have to vote in person. And I just wanted to mention the percentage of members that voted in favor of this motion by region, because one of the things that we were frequently told was that this might be seen as the global north talking to the global south. But 85% of African organizations that voted yes. It was 88 in Eastern Europe and North and Central Asia, 88% in Meso and South America, 96% in North America, 100% in Oceania and West Asia, 94% in South and East Asia, and 92% in Western Europe. So we found that our positive framing and this way of looking at barriers to family planning led to a landslide. So we're confident now that we can say that this has widespread support. So could I please move on to my final slide? So looking really now to next steps. So we're in the process at the moment of finishing the terms of reference for the task force. There's around 30 people that are on the task force. A lot of them are the kind of people that are on this call, or what I call the usual suspects, people that have been involved with PHE for a long time. But we're also bringing in experts from sexual and reproductive health from non-IUCN members, from organizations whose sole work is very traditional running clinics in low-income settings. So then, of course, we've got to focus on what we're actually going to do with the task force. So we're going to be setting up working groups to try and have a range of publications throughout the years. And that might be, that will be a publication on saying what are barriers to family planning, a separate one on what are rights-based indicators for PHE. We're going to develop a training program for conservationists on how they can learn about PHE and broader issues within reproductive health. We will have the guidance on how countries can bring the importance of removing barriers to family planning into their national planning processes under CBD, and a whole lot else besides that. So I suppose my two concluding points are what we wanted to do was bring this task force into IUCN so we could elevate PHE and barriers to family planning in branded IUCN materials that we can collectively work on. But then I think the second bit that's important for us is that we feel that conservation organizations should be confident to highlight that barriers to family planning are always wrong wherever they are in the world, irrespective of whether they're implementing a PHE project or not, which is why PHE for us fits under the broader topic of removing barriers to family planning as one example of a programmatic opportunity that conservation organizations can take with reproductive health organizations. And thanks for the opportunity of sharing a quick update on our task force.
Great, David, thank you so much. And thank you so much for your leadership on this. I know it's been a long process and has been challenging, but it's also exciting to hear that this was put into the non-controversial topic category, and that that we are seeing, changing perspectives on these sets of issues. So that's fantastic. And we look forward to working with you guys on this moving forward.
Thank you.
So I'm going to turn it over now to Megan Murison and Claire Relton, who are going to tell us about another really exciting development that we've had in the world of PHE and linking to conservation. So over to you guys.
Thanks, Janice. So there are some photos in the slide that I think David's going to recognize. We have credited you. So hi everyone, my name is Megan Murison. I'm based in Johannesburg, South Africa, and I'm from the Endangered Wildlife Trust. Just to introduce my colleagues that worked on this with me. We have Claire Relton. She's from Durrell, and she'll be joining this presentation later with some of the things that we're doing this year, as well as Erica Cochran, who I think might be in the audience. So to give you a brief background, what the CMP is. So it's the Conservation Measures Partnership, and it's a group of conservation organizations that are working together to improve the design, managing, and overseeing of conservation outcomes. And this learning initiative was actually one of many. So myself and Claire are going to take you through what we did last year for 2020 and what we have planned and are doing for 2021. Next slide, please, Janice.
Did it advance? Can you see it?
No, not yet. Oh, there we go. Yes. So this learning initiative explored the benefits for conservation organizations by integrating health through a PHE approach. We wanted to identify the barriers to uptake, as well as recommend possible actions and solutions going forward. Within the learning group, we had 4 facilitators and 29 PHE experts from around the globe. This work was done over a short period of time, and we are so thankful to all the experts for their amount of time and work that they put into this learning initiative. Next slide, please.
Do it again. Hold on. Okay, I changed it.
It's still coming. There we go. So I'm not going to go into the methodology due to the time limit, but I'm going to talk about some of the outcomes that we have. So the first was a final report, and this housed a working definition of PHE for the conservation organization. Basically, what this is for conservation organizations to be able to explain PHE to staff, donors, and so on. We also developed 2 theory of changes. One was a general TOC and looked at sort of integrating health into conservation, while another was specifically integrating reproductive health and family planning into conservation projects. This TOC Claire will actually talk about after this slide. We also performed some key informant interviews, one with PHE experts to sort of guide our learning process and make sure that we were talking about the right thing. And the other was to chat to CMP members, which are conservation organizations, about their knowledge of PHE and as well as identify the barriers. Interestingly, the biggest barriers that were identified were the lack of funding opportunities, as well as a lack of awareness and knowledge, particularly when communicating population and PHE. We also have a curated resource folder with helpful links that contain everything about PHE, what it is, how to talk about it, and so on. And there is also a final report folder that has all these documents in, and they are freely accessible. And if you'd like to have any of the links, please contact myself or Claire. Claire will now take us through the theory of change and also what we have planned for 2021.
Thanks, Megs. So as Megs mentioned, we created a number of these theories of change during this learning initiative. Don't worry too much about all these complex boxes. This one in particular was looking at the specifics around integrating reproductive health and family planning into conservation action. So right on the left-hand side, we had a number of enabling conditions that we needed to be in place. And essentially, this theory just lays out our assumptions for how we expect the provision of family planning and reproductive services to lead to healthier families and families having more time and energy and capacity to become involved in sustainable livelihood initiatives and natural resource management processes. And hopefully we were hoping that this would then lead to the simultaneous benefit to both humans and biodiversity. And it basically elaborates on how human health and environmental health are inextricably linked. We've also got a number of those supporting strategies, which are those yellow hexagons around the side, basically which showed that we may need a number of strategies working together in order to achieve this ultimate outcomes at the end of the day. Next slide, please, Janet. So much of our initiative in 2021 is basically focused on looking at that theory of change and critically assessing the assumptions that we made. So we want to identify a number of case studies, and we want to use those real world case studies basically to investigate whether our assumptions were reasonably accurate, whether there were major gaps or issues in that theory of change, and simultaneously to identify what key indicators or measures of success can we use in order to test the assumptions through time. Through this process, hopefully we were hoping to develop a number of case study example theories of change that we can add to CAMEL, or the Conservation Action and Measures Library, which is a library of resources around different conservation strategies that helps conservation practitioners to plan their strategies, plan and adapt their strategies depending on their context. We're also working on a draft paper, which we hope to eventually publish in the Journal of Conservation Science and Practice. And through collaboration with our partners, we are hoping to share as much of these lessons and resources and information as possible, particularly across online forums similar to this. And in essence, we want to develop a longer term outreach plan for how we can share this knowledge, share these learnings, and work to adapt and improve these integrated conservation and health projects across Africa and hopefully globally around the world. And then I think it's just the last slide, Janet.
Great. Excellent. Thank you, guys.
Yeah, I just wanted to mention that, as Meg said, all of our resources are openly accessible. So if you would like access to them, if you'd like to be part of this learning initiative, you can contact myself at claire.relton@durrell.org or Megan at meganm@ewt.org.za. And yeah, just a big thank you to Janet for allowing us to be a part of this and showcase this work.
Great. Thank you guys so much for joining. This is so exciting to kind of get this global scope about how, you know, the conservation community is moving forward. And then this look at the more conservation practitioner side, and getting this into the conservation library, I think is a huge step forward. So thank you guys so much for all your work and leadership on this. It's been fantastic working with you guys. So I'm just going to close out the third presentation here, which is our Africa Biodiversity Collaborative Group PHE reference guide. It's posted on the ABCG site, so I'll put that link in the chat when I'm finished. And just by way of background, I think you guys have already heard, like, why are we addressing these issues? It's quite important, especially in the context of sub-Saharan Africa. The theory of change that was just presented very much mirrors the one that we have done for Africa Biodiversity Collaborative Group. We had you know, the USAID Threats Assessment workshop. I think it was 2018. We went through and, you know, what are the drivers? What are the factors that are influencing conservation in Africa, and population and growth, and you know, the human health concerns definitely were still very much front of mind. And so that is why we've been spending the last 2 years working on this sets of issues with our colleagues in Africa. And in future brown bags in this series, you're going to hear from more of our African colleagues, you know, in addition to South Africa, who we've heard from today. We'll also hopefully have Ethiopia, Cameroon, Tanzania, and many others. So basically, we have this opportunity to work with our field programs, the WWF US folks who have been working in Cameroon in partnership, and then Jane Goodall in Tanzania. So really leveraging the collective knowledge. A lot of our fellow PHE experts are on this call, and we've really tried to tap into everyone to try to figure out what was really needed right now in the PHE space in Africa, and to really fill the gaps that we saw. And so one of those gaps that we saw is that we have great resources on monitoring and evaluation. The Measure, USAID funded Measure project has really moved us forward in terms of monitoring evaluation in this space over the past 20 years. And we really, you know, looked at what they had put together, and we did maybe just a little short, I don't know if you want to call it cheat sheet, but we're calling it reference sheet, where we really gave, you know, program planners some ideas for what are those key indicators you need to have on the family planning, reproductive side, the biodiversity side, and how do you measure integration? How do you put those things together? The concept of value added that we've talked about for many years, about you know, what is the bigger impact that you see from combining these sectors? We're so used to working in silos that when we come together, there really is this much more collective energy and collective impact. And we definitely see that on the ground in the places where we work, the people whose lives are not sectorally separated, right? They are community health, ecosystem health, that's where they are. And so we are going to spend the next 2 months really disseminating this work. We're hosting this series of webinars. We really want to get out to donors and practitioners the benefits of these approaches. And I think taken together, you know, with the IUCN motion and the CMP learning initiative, this really presents like a great momentum in this space at this time, in this very critical year, right, as we're kind of building back and recovering. So I'll just ask Natalie and Stephanie if they wanted to add anything, because this has certainly been a collective effort. And I'm going to stop sharing my screen so I can see you all now. But maybe just if you guys, Natalie and Stephanie, you want to make any comments or add anything in the chat, please go ahead. We have lots of time for questions now, so I'd really like to open it up. And it's great to see all you guys on the call. Thank you so much for joining us.
Hi, this is Natalie. I don't have anything to add, Janet. I think you've covered it really nicely, and thanks for you know, inviting these great organizations, these great people that we work with to talk about what's new in the world of PHE. And I think I'm excited to continue working on that in the next couple months, to share with everybody and people, hopefully people who don't know much about PHE, how to get that going and how to integrate that in their conservation initiatives, and so that we go beyond talking to a group of practitioners that we don't need to convince anymore, but we need to, you know, turn the tables and make more people you know, aware of this great work that's happening in the world of PHE. So thanks, and look forward to seeing maybe more of you all in the next the coming webinars, discussing the reference sheet and beyond, and our experiences in the different countries that we've been you know, experiencing some pilot projects on PHE through ABCG. Thank you.
Great. Thanks, Natalie. And it's nice to get your dog's endorsement of your statement as well. That was lovely.
Yes, he seems to be high maintenance in the morning.
Great. Thank you so much. Yeah, I think this is such an exciting time, and I think there are definitely lots of opportunities now. And this is it's great to have you guys all on the call to help and help with the work going forward. So does anyone have any questions? I think you can unmute, or you can put it in the chat, however you want to do it. We're pretty informal, right? Anyone have any burning questions? I mean, maybe I'll start us off and maybe ask David, what do you see as maybe one of your biggest challenges going forward with the IUCN motion? What do you think is going to be the toughest thing to overcome?
Lack of staff capacity. Yeah, to be honest, actually, that might be the main issue, because we're seeing that we've really been taken aback by the positivity that this has had. So we had 2 of the 6 IUCN commissions were named in the motion text, which, you know, they had to approve before we tabled the motion. And since then, a 3rd commission's come along and said they really want to be involved because they're glad to see finally there's something about this topic happening at IUCN. And if you roll back a couple of years, several organizations were saying to us that we wouldn't expect to get the success at IUCN, but we just haven't found it hard. So I suppose that's a bit of an odd challenge to say, is that we're short of staff capacity, but that is it, because it's just being taken so positively.
That's great. That's definite. And it sounds like your training programs there may help kind of spread the ability, right? And the capacity.
That's the hope, yes. So once the task force is set up, we'll have several working groups where volunteers can be assigned to, we'll let you know what one of the many things we'd like to produce, and we'll get consultants involved with some of them. But actually I think that's one of the key things we would like to do, is have a course that can then be promoted again by IUCN. I mean, that's just the reason we see this as strategic, because it's going to be IUCN emails promoting doing an IUCN branded course that will be using lots of the materials we've spoken about today. We'll be using lots of the stuff from the CMP learning initiatives. But yeah, I can't stress enough how positively we are hearing all of the feedback on this, which is why this is, as you say, I think it is finally PHE could be about to really grow.
Right. And I noticed Sarah, our colleague from Knowledge Success, also put in the chat another link to a lot of great resources. And definitely, through CMP, we definitely learned about who's doing what in this space and what assumptions we have to unpack. So I think that's also going to be really important going forward. Definitely. Great. You're getting lots of kudos in the chat, David.
All right. Well, I'll read that then.
Maybe Megan and Claire, maybe the same question for you. Like, what do you see as maybe some of the challenges with the conservation measures partnership and that process going forward?
I'll start maybe with mine. One of the biggest barriers that was identified was a funding opportunity, as well as not knowing the right partners. So I think it's a combination of not conservation organizations not being able to, or feeling like they're not able to speak about population in the broader context, not knowing who the right people are to get involved, not knowing how to approach a donor and actually discuss why family planning is important to conserving an area, a species. So I think that's something that needs to be overcome, and I think it will take time, but I think when it comes to that, it's webinars like this, actually talking with each other and sharing lessons learned, that we actually get started on that path. And you, Claire?
No, I mean, I was actually talking specifically about our learning initiative and getting everything done in time, because essentially our deadline for this is the end of the year, and we've got, I mean, you saw that list of deliverables we need to achieve. So time-wise, we got to get going, but we've got a great team of people, as you know, and I'm pretty hopeful that we're going to get some really good case studies, and our theories of change will be robust enough to use and to test our assumptions. So I'm optimistic about it, but I'm a little bit nervous about just the amount of time we have left. But similarly to last year, I'm really hoping that we can expand this initiative into 2022 going forward. There's always additional funding for these sorts of things. So if we can just continue to build on this initiative, I think that would be fantastic.
Yeah, and I just want to mention, you guys have heard me say this, but the way the conservation community has changed over the past 20 years, it used to be very much species and protected areas focused, and really the whole community has really become more landscape oriented. And I think as we look at these broader landscapes, you bring in all these different aspects of the landscape, and certainly family planning, reproductive health, water sanitation and hygiene, which is another big part of the ABCG work that we've done, integrating freshwater conservation and WASH. All of these things really come together, and it can't be siloed, right? It has to be very multi-sectoral. So, and for those of you who know about ABCG, we're really in a transition phase where we really are trying to move from the model, which has been, big NGO focused, and moving more toward being grounded in Africa, with Africa leadership and Africa priorities and decision making. And that process is going on. So you'll be definitely hearing more about that. So it looks like Rose has turned her camera on. Would you like to ask a question or make a comment?
Good afternoon, everyone. My name is Rose Timanzi. I work for Community South Africa Trust on scaling up the family planning into conservation using the PHE approach. I've just joined late. I had challenges with my network, and I'm happy to connect in this. One of the things I would just mention is that without considering population into conservation may not meet their intended goals if the population and health of the communities is not as well considered.
Yes, I think everyone would agree with you on that. That's great, the work that you're doing. Very exciting. We're glad to have you and definitely look forward to working with you more.
Thank you.
Great. Does anyone else have any questions or anything they want to say?
I have a question.
Sure. Go ahead.
Hi. I am the project manager at Impact Madagascar, and we're primarily a biodiversity conservation organization. We're pretty small, but we've been wanting to get into more family planning type of activities. And I know you guys have shared a lot of great resources, but I'm wondering really what are the practical steps that we can take with such a small team, and how can we move forward in the best way possible for that?
Great. Have you met the PHE network in Madagascar yet? I would think that would be maybe the first step. Will you guys talk to them?
Yeah. I've been to a couple of meetings with them, and we're in communication with them.
Sorry, you're lagging a little bit on my side. So it sounds like you have connected with that very vibrant network, and maybe the next thing to do would be maybe looking at the places where
we don't have anything planned as of yet for our initiatives, and we're really trying to.
Sorry, I think we have a little bit of lag. I think there's definitely a couple of people on the call who would like to follow up with you on that, because there are lots of different tools and resources that we can share with you. Yeah, it's exciting to see you're interested in the space, definitely. Yeah, David's asking you to turn your video off. Maybe that would help with the connection.
Sorry, my Wi-Fi.
But if you want to drop your email in the chat too, we can also follow up with you afterwards. So you're in, one of the key PHE success areas in terms of Madagascar, right? So there's definitely lots of resources, I think, and lots of colleagues that can help.
Yeah, sorry.
That's okay, no problem. But I think assessing community needs and priorities would probably be your first step, right? Okay, anyone else have any questions or anything that they want to add? I see Serge has also added in a comment, Haley. So if you can look in the chat and look for Serge's comment, that would be great.
Hi, Janet. This is Rick Hughes. I'm a reproductive health professional, but I also ran the World Wildlife Federation program in the West Indian Ocean.
Yeah, great to see you. David. Thank you for joining us.
Yeah, thanks. David and the rest of the group, you've done great work, and there's a lot to be said for a real focus on reproductive health and family planning. But on the health side, there's some impetus and push really towards primary health care. And one of my concerns in the conservation side on PHE is with a focus on sexual reproductive health. I always felt like looking at landscapes and looking at communities that there's missed opportunity in really looking at primary health care. A lot of family planning decisions revolve around whether children are going to survive. There's a lot of child health that goes into behavioral economics around decision making. I'm wondering in your discussions whether you felt or seen opportunities to look at a slightly broader primary healthcare platform as a vehicle to really drive changes in core communities and countries.
David, I think that was for you.
Yeah. Oh, okay. Yeah, sure. Yeah, so I suppose I'd say to that, it depends on whether we're focusing on what the task force does, what will you do in an individual project. And the purpose of our task force was to try and win an argument, which was that this is relevant to biodiversity. So we felt that we needed to keep it narrower. But then, of course, in our project with the International Crane Foundation and the Endangered Wildlife Trust, clinics have been reopened that were closed before. So the clinics aren't only providing reproductive health services, they are providing primary health cover. They provide all of the primary health care services that you would expect to get now the clinics have reopened. But for our donor, we needed to focus on what were the most relevant arguments to make a biodiversity fund that actually pay to reopen the clinics. So I don't know, as an example, we're now doing STI screening and cervical screening and a whole range of other issues beyond reproductive health or beyond contraception. But those arguments wouldn't have been relevant to the donor. So I suppose I would agree with you, because obviously primary health is critical, but it's about when do you employ the argument to either convince a partner to work with you or to pay for it, being brutally honest.
Can I jump in on that? This is Nathalie. WWF, for the time, like the past maybe 15 years or so that we have done integrated approaches, health and environment integrated approaches, and PHE basically, we've always had an outlook of the H in the PHE just as strong as the P in the PHE. We have not been able to just focus on population issues, on family planning, reproductive health, because there's so many other priorities in the communities that we work in, and we come in with a vision that we're going to tackle primary healthcare issues, and family planning, reproductive health is one of these issues that fits in, and so it's always a very multi-sectoral, multi-task team that works on these issues, and health is always at the forefront of the work that we do in PHE. Just so you have a better idea of what we do in PHE. It's rarely just population issues and environment. It's always an integrated approach, with health being very important in there.
I think actually I'd like to amplify something Natalie's just said, just by giving you a real world example of something that's come up with us in the last few weeks. We've gone through a process of some Ugandan academics have spent 6 months in the communities talking to them about what they perceive to be their concerns, challenges, and the connections between, livelihoods, health, etc. One of the health challenges that we had not thought was an issue in the area is, slightly surprisingly, we're in a wetland, and a lot of people had thought there was an issue with snails and getting into people's throats. And it turns out that it's actually tonsillitis, and that because there's lots of snails in the area, that there's a widespread community myth collecting snails and tonsillitis. So, tonsillitis wasn't something that we thought we would be including in our community education until we found this out. But obviously we are, because it's one of the issues that has been highlighted by the community. So the community needs obviously are critical, and in this particular example, tonsillitis happens to be an issue.
Yeah, that's great. And Colleen also put in the chat, Colleen Sorto, who leads the ABCG Freshwater Wash Working Group, was building on what Natalie said about community needs and very much the concern for childhood illnesses and childhood diarrhea really sparked a lot of the work in the water sanitation and hygiene space that we've done with development partners and others in Africa, Madagascar especially. Great. Anyone else have any questions? This has been a great dialogue so far. Any of our Madagascar colleagues want to add anything? It looks like we have a nice contingent on the call today. Or anyone who wants to add in? Maybe I'll ask one of my favorite questions, which is about gender. And definitely over, the time I've worked on PHE have really looked at the gender aspects and wondering if David or Claire or Megan, are you looking at gender in any of the initiatives that you're doing? I know for ABCG, we've tried to take a more intentional gender approach. This grant period, it's been a bit challenging, but I think we have some interesting impacts and results to share on that. Does anyone have anything to say about that?
Yeah, I suppose just to say what we're doing currently in Uganda then, because beyond the healthcare provision element, there's one of the key things is in the setting up of the community conservation groups. It's been key that so they're well, I suppose you can imagine the formal organisations registered with the local government, with key community members. But then it's been important that that there's an equal representation of men and women, because the livelihoods are focused slightly disproportionately on women rather than men. And there's been all sorts of avenues like that gender's been brought into the program design.
That's great.
Yeah. Hello.
Hi.
It's Fiona,
Fiona.
talking about somebody that's working on the Ugandan project. I didn't know you were here.
Yeah, I'm here. Hello, David. Hello, everyone. Yeah, I was supporting your point, saying that we are working with the community groups, which membership has many women than men, but we have at least tried to bring men on board so that we have gender issues addressed.
Great. Thank you so much for joining us, and great work that you're doing. That's excellent.
Welcome.
Good.
Sorry?
No, that's wonderful. We look forward to hearing how it goes.
Yeah.
Good. Okay, well, I think we're nearing the end of our time. If we don't have any other questions or any other interventions, I want to thank you all very much for joining us. We're going to post this recording to the ABCG website, and we really appreciate David and Megan and Claire joining us for this first webinar. We're going to hopefully do a couple more, so stay tuned for a couple more exciting webinars in August and September. And we thank you guys very much. And please let us know if you have any questions or follow-ups. And thanks for your patience with my technology challenges.
Thank you for organizing.
Yeah, it's fun. Always good to see you guys.
Thank you so much.
Great to see you.
Great to see you, Janet.
Yeah, you too.
Hi, Claire.
Hi, Fiona.
Nice to see you. Hi, Megan.
Hello.
Hi, Harriet. Hi.
Bye, everyone.
Cheers.
Bye, Harriet.